for your deductible, which could be $2, $3, $4, $5,000. And if you know anything about breast cancer, it can metastasize and move very quickly. I lost a friend of mine I talked with years ago because of that. So we worked together and we got a bill passed that if you're on a state health plan, you can get an MRI and an ultrasound for free as a part of your diagnostic. And a lot of people say, well, Doc, how did you get involved? Why are you pushing this bill? Because I said, it's not just a woman's concern. It's a family concern and it's a community concern. One thing we learned many years ago in the Air Force during the first Gulf War, when we called people, reserve young would come in and negotiate. Then they bring in Martin Luther King. And that's kind of the same thing we try to do when we work with these bills. I get the late Vincent Ford, God bless him. He was the guy sent in the rat, get him stirred up. Now, I don't know how many of you know Vincent Ford, but Vincent was a warrior. Then myself, after him, I come in and say, well, let's talk about this. and things work out. But anything we can do for you, let us know. Everybody calls me Doc because when I was in the Air Force, they sent me to the University of Georgia to complete my PhD. I said to him, you sure you got the right person? Because see, when I joined the Air Force, I lost a bet. I was playing a game of pool with the recruiter. And if I won, I was supposed to get $50. And if I lost, I had to join the Air Force. So I was just trying to finish my little 4-year term here. And they talk about going to college. I'm like, you definitely got the wrong person. But anything we can do to help you, let us know. Doc, Rhett, Senator Rhett. I answered to all of them. Just don't call me late for supper and we'll be all right. Thank you.
Well, I want to first acknowledge and thank all of our state legislators who have been here. I do see Representative Evans is there. We'll be calling her up in a moment. But thank you all so much for coming here today. We're so happy to see, again, as was mentioned, we're in the people's house and to be here and to be so welcomed by our state representatives and our state senators. It shows that the work that we're doing is being recognized and that people are paying attention to this. And if we can keep this momentum moving forward, that's why we do this. That's why we've been doing this. This is the 8th Annual Cervical Cancer Awareness Day event. And it's so good to have everybody here. So that being said, very quickly, my name is Dr. Robert Bednarczyk. I'm a faculty member at Emory University Rollins School of Public Health. I'll be moderating today's event. I do want to welcome you all on behalf of the Georgia Cancer Control Consortium, the Susan Jolley Foundation, HPV Cancer-Free Georgia, which is our state HPV working group, part of the Georgia Cancer Control Consortium. Thank you for coming to the 8th Annual Cervical Cancer Awareness Day event. We've been coming here for the last 8 years, but even before that, Triana, wherever she stepped out to, had been doing this even for a few years before we came in and organized it with that. So this is a decade now that we've had an opportunity to come to the Capitol to have these moments to introduce ourselves, to work together, to network across all of our colleagues. It's just so wonderful to have everybody here. As I mentioned, I'm a faculty member in global health and epidemiology at Emory Rollins School of Public Health. I'm also at the Winship Cancer Institute, where I do cancer prevention research focused on HPV vaccine. And I'm also the associate director for vaccine policy at the Emory Vaccine Center. So again, all of these issues, these bills, these laws that we're talking about, all of these issues around vaccine policy, this is very critical. This is what I do and what I think about every day. And we're here to talk about cervical cancer, Cervical Cancer Awareness Day, January Cervical Cancer Awareness Month. But HPV vaccination can actually prevent 6 total cancers. It's not just cervical cancer. It goes beyond that. It's over 40,000 cases of cancer a year in the US that are associated with this virus that can be prevented by vaccination. So that's why we're here. That's why we're trying to spread the word about this and improve our level of advocacy. Just as a reminder, this meeting is being live streamed on Zoom. It is being recorded. That recording will go up onto the HPV Cancer-Free Georgia YouTube page. If you haven't already clicked like and subscribe, please do that. You can tell that I listen to a lot of podcasts. So smash that subscribe button. But Again, as you know, technology can be finicky, so please bear with us if there's any issues. If there's anything that we've learned working in public health is you need to adjust to situations. Our state legislators who are here already that had to leave because of other meetings they had, we've had to move some things around a little bit. But just again, please work with us and bear with us on that. Also, I want to let you know that this year's event, we will be providing continuing education credits that have been sponsored by Piedmont Healthcare and by Cancer Pathways. So if you are planning on receiving continuing ed credits for this event, please fill out the survey that will be sent at the conclusion of this. There is information at one of the tables outside as well, so that you can ensure that you get your credit for that. So this year's theme, and something that we're very, very happy to be focused on, is cervical cancer elimination. In 2018, the Director General of the World Health Organization issued a global call for the elimination of cervical cancer as a public health problem. In 2020, the World Health Assembly adopted the Global Strategy for Cervical Cancer Elimination. The goal of this is to reduce the incidence of cervical cancer to less than 4 cases per 100,000 women, globally, in every country, and in every geography. So it's great if we could get that for the US, but if Georgia is still higher than that, it doesn't matter. We need to reach that level everywhere. In 2023 globally, 13.3 cases of cervical cancer per every 100,000 women. So we're over 3.5 times higher than that goal that we've set. In the US, that rate is 7 cases per 100,000 women. And here in the state of Georgia, that rate is 7.5 per 100,000. So we're doing a little bit worse than the national average here in Georgia. This is, again, why we come here. Now, before I get too far into the program, before I get too far into all these discussions, before I mention anything about that, who has heard about plans for cervical cancer elimination? If you're on the Zoom, if you could please enter into the chat box if you've heard about that. If you're here in the room, have you heard about cervical cancer elimination before about 2 minutes ago? Raise your hand, please. Very, very few, and it's all of my colleagues and all of my friends who work in public health. But again, for our state representatives, our state senators, this is why we're here. We have set an audacious goal. But unless you set those audacious goals, you're never going to reach them, or you're never going to come close. And that's why we're working towards that. So thank you all. Jen, I don't know if there's many people, or if you're just not even hearing a smattering of anything online. A couple, yeah. But again, this is something that we have really set up to be that goal. I know for me personally, I'm working with a number of different HPV roundtables, including the HPV Roundtable of the Southeast, headquartered out of St. Jude in Memphis, where we're actually working on developing toolkits for states to develop their own cervical cancer elimination plans. So you all are going to be hearing a lot more about that from me and from all of our colleagues coming up soon. But the thing is, with these cancers, they're almost entirely preventable. We have a vaccine that has exceeded our wildest expectations. There was a study that was published from Scotland at the beginning, just about a year ago, beginning of 2024. Girls who were vaccinated at the right age, at 12 to 13 years of age, following them up for 10, 12 years, their non-vaccinated friends and neighbors in that same age group had cervical cancer rates that looked just like the rest of the country, about 7 per 100,000. The girls who got vaccinated at the appropriate age, 0. Not a single case of cervical cancer in any of the girls who were vaccinated at the right age. That's almost unheard of in the world of vaccines. We know vaccines are good. We know some vaccines are great. Cervical cancer vaccine, HPV vaccine is a great vaccine. So we know that we can prevent these cancers, and that's why we're gathered here today. So again, I just want to give a big thanks and a big shout out to our sponsors, the Northwest Georgia Regional Cancer Coalition, Cancer Pathways, the Hispanic Health Coalition of Georgia, the Augusta University Medical Partnership with the University of Georgia, the Emory University Nell Hodgkins Woodruff School of Nursing, and the American Medical Women's Association. We wouldn't be able to be here, we wouldn't be able to have you all here without the support of all of our sponsors. We do have a very, very packed agenda today. And it's, just up here, just very quickly, where we're at. We have some amazing speakers, and we do really want to get right to all of this. I do want to acknowledge really quickly, so you can see that there is recognition of the 2025 HPV champions there. One of our champions, the East Georgia Cancer Coalition, does need to leave to get to another meeting. We do want to recognize them before they have to leave. We will have full recognition of all of our champions later. We'll have an opportunity for people to come up and speak to acknowledge that. But for our colleagues from the East Georgia Cancer Coalition, if you haven't left yet already, we do have a recognition for you. I don't know, Allison. Oh, okay. Do you have the, okay, perfect. So for our friends from the East Georgia Cancer Coalition, thank you very much for the work that you do. We really appreciate it. We know that you need to run, but we really appreciate you making the time to come out here and be with us and to help celebrate the amazing work you've done to spread the word and reach out to your communities in East Georgia. So thank you very much. Oh. Yep. Thank you so much. So as I mentioned, again, being here, being in the state capitol, it's very appropriate to have our state legislators come and speak. Again, we heard from a number of people before the start of the official program, but I would like to acknowledge and have Representative Stacey Evans come up, invite her up to be our first speaker. Representative Evans has been a staunch supporter of our Cervical Cancer Awareness Day. She's been a strong advocate for women's health issues in Georgia, routinely addresses the legislature regarding these issues, and actually is sponsoring a resolution in the Georgia House to officially recognize today, January 16th, as Cervical Cancer Awareness Day for 2025. And with that, it's my pleasure to introduce Representative Stacey.
Comes up real quick.
Yes.
Y'all know I always have a story. But as you all know, this 8 years with all of the partnership, but it's 10 years for me coming down here advocating for cervical cancer and HPV. And the original, the OG, now this sponsor of cervical cancer awareness was Representative Stacey Evans. When we first, well, we've known each other for a while, but we sat down at Rev Coffee and we talked about Medicaid expansion and cervical cancer and HPV, and really helped me to turn my pain into purpose, and was there for me when my Susan, when she passed away. So the original one that gave me all of this to do, she stepped up, and I love her and always have loved her. She was my representative as well in the beginning. So that's my story, Representative Stacey Evans.
Sorry, the names that was given, I didn't know about Representative Sanchez, but Representative as well. So thank you very much.
Thank you. Well, thank you so much. It's so fun to look out and see some familiar and friendly faces, and I love you so much. She's like my sister. And I was representing, so I represent House District 57, which is parts of Atlanta. I'm Stacey Evans. I'm so happy to be with you. But when I met Triana, feels like a whole other life ago. I was representing House District 42, and we started this tradition of this event eventually. And then Representative Terry Nolowitz was representing District 42 for several years, and she took over this journey. And now I wanted to make sure that y'all met Representative Sanchez, who is now the representative of District 42, because it doesn't really matter if Triana lives in 42 anymore. This is a District 42 event. And so whether you're District 42 or an alumni, we will be here for you, anything we can do. But really, thank you for taking your time out today to be here, to learn, to advocate. I mean, y'all know better than anybody else. Everybody reach one, everybody teach one. And that's what we're gonna do today. We're gonna take these voices from in here and we're gonna spread it out. But I'm here and I'll try not to do further ado. You give an elected official the podium and you never know what's gonna happen. But we were able to pass a resolution in the State House this week to recognize this event. And Representative Sanchez was a co-sponsor of this with me, along with Dr. Michelle Al, who is an advocate for all things healthcare. And we're just so happy to be here. So I'm gonna read some of this. I promise not to read all of it. But this is a resolution recognizing and commending the Georgia Cancer Control Consortium as part of the Georgia Department of Public Health, HPV CancerFree Georgia, Cancer Pathways, and the Susan Jolley Awareness Program for their exceptional contributions to cervical cancer education and awareness in Georgia. Whereas January is designated by the United States Congress as Cervical Cancer Awareness Month. Whereas in the state of Georgia, the state level cervical cancer screening rate, and this is our work, y'all, the state of Georgia, the state level cervical cancer screening rate is below the national average of 76.5%, with 1 out of 5 women in Georgia not receiving regular screenings for cervical cancer. Whereas the geographical disparities within Georgia counties include Forsyth, McIntosh, Towns, and Franklin counties, raise your hand, where the screening levels are lower than 60%. So we got to reach our sisters there. Whereas only 59% of Georgia adolescents are up to date with the recommended doses of HPV vaccination, and the HPV vaccination rate in Georgia is below the Healthy People 2030 target rate of 80%. Whereas cervical cancer is the most often diagnosed between the ages of 35 and 44, the average age of diagnosis in the US is 50, and about 20% of cervical cancers are diagnosed after 65. While guidelines often recommend stopping cervical cancer screenings after 65 for individuals with a history of normal test results, those without such a history are encouraged to continue. Now, therefore, be it resolved by the House of Representatives that the members of this body recognize and commend the 2025 HPV champions, as well as the Georgia Cancer Control Consortium, HPV CancerFree Georgia, Cancer Pathways, and the Susan Jolley Awareness Program for their exceptional efforts and commitment to advancing cervical awareness and eliminating this disease. So thank you for the honor of being able to present this and to commend you for your work. Let me just say one more thing about Triana James. All I know is whether it's prevention of cancer, running for office, starting a business, making sure my kids get on the bus, whatever it is, this woman, if she decides that's her mission, come hell or high water, she is going to get it done. So cervical cancer, watch out, because Triana James is coming for you, and now she's got this army. So thank you so much for letting me speak.
We are going to eliminate cervical cancer. Yes, amen. Once and for all. Can you get a photo? Husband? He doesn't have a name. Thank you so much.
Thanks, y'all.
Thank you very much, Congresswoman Evans, Congressman Sanchez, for coming here and for your commitment to improving the health and the lives of women across Georgia. Your assistance in this effort, this resolution really just serves to keep pushing this forward. And we're very appreciative of that work. I think everybody in the room can agree with that. Next, it's my privilege to introduce our next speaker, cancer survivor, Ms. Andrea Gonzalez. Andrea comes to us. Okay, sorry, I know where you're sitting. Thank you. Yeah, so she comes to us today to just tell her story about being a cancer survivor. Thank you.
Thank you. Well, hi everyone. Thanks for this opportunity. I'm quite new in this path of advocating. So thanks for the possibility, and thanks for this little space. I'm Andrea Gonzalez. I am 53 years old. I was born in Chicago, but I lived most of my life in Argentina. So forgive me, English is my second language. So just in case. I'm a mom of 3. I have 3 daughters. One of them is in Argentina. She's 26. And my 2 other daughters are 12 and 13, and we live here. And I've always been healthy. I've always been had normal life. I always had my regular pap exams. One year while we were moving from Miami to here, I missed that my pap exam. But when I found it, I mean, when I had it, finally had it, that was January 2023. You know, I've always been like, oh yeah, I just have to go and do it. You know, that's it. But this time was different. This time, I was told we found malignant cells, you know. So, and also here you're kind of announced, oh yes, you have cancer, you know, so quite shocking. First thing I had was a LEAP intervention. Also, some friends had told me, oh yeah, you're gonna have that and you're gonna be fine. I had that LEAP and margins came positive, so that wasn't fine. And so I found out that I had to start a chemotherapy and radiation treatment. By this time, I was really thinking, okay, this is it. Am I going to die? You know, it's just cancer. I mean, not until somebody tells you that you have it, you never thought you're going to get it. You never think you're going to get it. And also, my personal relation with people that had cancer, my dad, my grandparents, that they were always terminal and with a lot of suffering, you know, related to their process. So I really didn't know any other path possible for treating cancer. So without knowing much, and thank God having my brother, he's a doctor. He's actually in Chicago, but he helped me a lot because also I was quite new to the whole health system here in the States. I kind of had to start it. And oh, and one thing is that I did not have the vaccine because the HPV vaccine, because when I was young, that did not exist as an option. So long story short, the treatment went well. Thank God. It was definitely a journey, a process. And I think that the treatment was just the beginning of the whole process, because there's so many things that you face once you're told you have cancer. You really start seeing your life in a different way. So this is my journey starting, and hopefully I'll be able to work along and you know and be a part of the whole awareness that we need to speak about and yeah, and work on everything that we're able to, especially with the vaccines, and also not forgetting about the, you know, the PAP exams that we need to get done and everything. My daughters, the three of them, already have that vaccine, thank God. And now that I'm going through this process, I'm even, you know, the first one I kind of work on her having the vaccine just because it's a protocol, you know, oh, it's one of the other vaccines that you need to have. But yeah, now with my younger girls, I'm definitely starting to know how valuable it is to have these vaccines. So I don't know, I'm happy and I'm grateful that it wasn't my time, but also, once you had that you were diagnosed with cancer, you start living with and knowing that it can come back anytime. So just like it can come, for the first time for anyone, it can also come back for once you've had it. And so one of the things that have really changed me quite a lot in this whole process and journey is being trying to be as responsible as possible about our health and our daughter's health. And so anything that we're able to do, and that we have our voices. And so that's why I'm thankful also for having this space, because it's something that we also have to learn, to use our voices and to make others aware as much as we can. So I don't know if you have any questions. I'm open, and yeah, and again, thanks for listening to me, because this is definitely part of the continuing healing in all the the physical, the emotional, the psychological healing that we all need to go through. So I really appreciate that you're listening and being able to do this.
Thank you, Andrea, for sharing your story and that powerful testimony about the impact that cervical cancer can have. I think sometimes, especially those of us working in public health, especially, we see numbers in spreadsheets, and we always need to be reminded sometimes that those numbers are people. And you coming and sharing your story, it means so much to all of us. To be able to have that face and to have that anchor point, and just to let us know that these aren't just abstract numbers, that these are, people and families, and I'm so happy to hear that your daughters are vaccinated. It's not great that you had to go through that, but the fact that it keeps moving forward, and that you're here to share that with us just means so much. So thank you very much. So next, it's my privilege to introduce our next speaker, a colleague of mine at Emory University and Winship Cancer Institute, Dr. Sarah Dilley. Dr. Dilley is a board-certified gynecologist who practices at Winship Cancer Institute at Emory University Midtown and Grady Memorial Hospital. She is an assistant professor in the Division of Gynecologic Oncology in the Department of Gynecology and Obstetrics at Emory University School of Medicine. So Dr. Dilley.
Okay, where's my the clicker for the, yeah. Oh, yeah. Oh, yeah. Okay, I'm gonna have to do a little bit of this. I hope you don't mind. Okay. Should I?
Yeah.
I move a lot, so this is probably. Sorry. Is that okay? Okay, perfect. Okay. Hi, everybody. Thank you so much for having me. I want to thank Andrea for telling her story. I know that's really hard to share. And so it's like Dr. Bob was saying, being able to put a face and a story with this cause that is really a passion for a lot of us is really important. I have the privilege of getting to take care of patients with cervical cancer every day. So I'm a gynecologic oncologist, and this is what I do. So these are the cancers that I take care of. So any cancer that originates from any of these organs is what I take care of. So specifically cervical cancer, this is I'm going to try to make it not too boring, but this is kind of the technical, what is cervical cancer part of today's program. So cervical cancer is, the cervix is the opening of the uterus, right? And that is, it's a very unique place and a unique disease. And that's why we are able to kind of, approach it with the vaccination. So just some high level details of cervical cancer. Worldwide, it's actually incredibly common. cervical cancer is the fourth most common cancer in women after breast, colorectal, and lung cancer. But in countries like the US, effective screening and now vaccination has decreased the incidence and mortality. It disproportionately affects women of color, which I'll touch on in a little bit. And it is, most women are diagnosed between age 35 and 44. So it usually affects women in their 40s and 50s. I really appreciated Representative Evans' point, though, that the women over age 65 are an increasing group that is getting cervical cancer at higher rates, and it's important that we not forget about them as well. So, but the impact really is in women who are actually quite young. So this is a diagram looking at sort of the burden of cervical cancer worldwide. The dark blue on the top, like the darker the blue, the more cervical cancer there is in that country, basically. And the darker the red, the higher the mortality rate is in those countries. So you can see sub-Saharan Africa and South America are especially hard hit. In the US, like I said, cervical cancer, luckily, is not even in the top 10 for women. Uterine cancer is of the cancers that I take care of is the most common. And if y'all want to invite me back in June for Endometrial and Uterine Cancer Awareness Month, I would love that. But just for some perspective, ovarian cancer affects about 19,000 women a year in the United States, uterine cervical cancer, about 13,000 women per year. So a lot less than breast, but still incredibly impactful. And another thing that's really important is that the most recent data from the American Cancer Society that shows that actually in the age group of where a large amount of women who are affected, ages 30 to 44, cervical cancer rates are actually on the rise. And that's not the case for all cancers. So, yeah, I'm sorry. I also move a lot. So. Is that better? Maybe. Okay, we'll find out. Okay. So specifically in the US and Georgia, so this is just numbers of cases per state. Obviously, the bigger states have more cases because there's more people, but just for some perspective, about 480 cases per year in Georgia. And then Dr. Bob was talking about some of the incidence rates. If you look, Georgia, we're not actually quite as bad as our neighbors to the east and to the south, but still kind of towards the higher numbers as far as incident rates in the country. And then in Georgia specifically, it's very geographically disparate. So there are some counties in the state that have, about average rates of cervical cancer, but some where they're much higher. So there are 5 counties in the state of Georgia that have a rate of over 11 per 100,000. And that's similar to some low and middle income countries in the world. And there are parts of like the Mississippi Delta, for example, where the rates of cervical cancer and mortality in cervical cancer is worse than that in sub-Saharan Africa. So really important to recognize that this affects very specific populations of people. Maybe. No. There we go. So, so the incidence rates have decreased again because we've done a really good job of preventing it, which Dr. Geitkin is going to talk about. But unfortunately, the mortality rates, so the rate of the risk of dying from cervical cancer has really leveled out over the last few decades. And this is one of the things that myself and my colleagues are trying to work on. This is just another way of showing that uterine cervical survival rates haven't budged a whole lot since the 70s. Again, mortality rates vary across the state, with some of the worst numbers being in the Southeast. And I think one thing I really want to hammer home is the importance of disparities, racial disparities in cervical cancer. So Black women, Hispanic women, Native American women. When I say women, obviously, I want to be inclusive. That's an easy way to say anyone who's born with the cervix, regardless of their gender identity, right? So anyone born with the cervix. But the rates of being diagnosed with this cancer is much higher in Black and brown women. And, which is even more striking, the risk of dying from cervical cancer in Black and brown women is much higher. So when we take all patients with cervical cancer, kind of regardless of what stage they're diagnosed at, the survival rate at 5 years is about 68%. So at the end of 5 years, 68% of women diagnosed with cervical cancer will still be alive. When you look at just Black women, it's only 57% of women who will still be alive at 5 years, which is not okay. So what is cervical cancer? How do we get it? We keep talking about HPV, but what does this mean? So more than 90% of cervical cancer is caused by the human papillomavirus. So HPV is an incredibly common virus. More than 80% of people in the US will excuse me, will get HPV in their lifetime. When patients ask me about it and they're like, oh no, I have an STD, what does this mean? I say, it's kind of like the common cold of the cervix. And it really is, if you are sexually active, there is a real good chance that you have been exposed to it. The thing is that most people clear it. Your immune system clears it like any other virus, but for some people that based on the strain of the type of HPV they have, or based on certain factors in their, of their body and their immune system, it may turn into a cancer. And there's no way to know exactly who's going to develop cervical cancer. Now, we do know that there are certain risk factors that make people more likely. So if you're exposed to HPV, if you are a smoker, you have a higher likelihood of it turning into cancer. We see it a lot in patients who are immunocompromised. We have some of our colleagues here who work over at the Ponce Clinic at Grady. We see a lot of cervical cancer in our HIV affected population, and same as as well as people who have autoimmune diseases or who are on medications for transplant. So anything that impairs your immune system, you're more likely to get this virus. Multiple lifetime sexual partners, unprotected sex, but again, it's so common that that's kind of less of a modifiable risk factor. And then I think really importantly, inconsistent or no screening. So half of patients diagnosed with cervical cancer have never been screened or have not been consistently screened. So there's a really large population of people who don't have access to the healthcare system consistently, who are much more at risk for cervical cancer. So what do we see when someone has cervical cancer? There's a lot of different ways someone can present. Most commonly what we see is vaginal bleeding at times when you usually don't have vaginal bleeding. So most of these women are premenopausal, so they still have regular periods, and so they might have heavier periods, bleeding between their periods, or vaginal bleeding after sex. Sorry, I'm a gynecologist, so I'm gonna use all the right words and get into the details. Excessive vaginal discharge that's abnormal color, odor, and pelvic pain sometimes. But it's really important to know, just like with Andrea, I hope you don't mind, I'm going to use you as an example. For a lot of women, there are no symptoms, and it's found on routine screening or found on an exam. The other thing that's important to talk about, and I don't know where Dr. Flowers went, but that we talk a lot about cervical cancer. There are also 200,000 cases per year of cervical precancer. And there's not enough time to talk about this, but this is also a really important health impact and public health impact of HPV. And so this leads to procedures that can impact people's fertility, that can cause incredible amounts of anxiety, lots of just having to use the healthcare system. And these cervical precancer, when treated appropriately, when it's caught early, you can prevent cervical cancer very well. But again, this HPV still causes this, which can cause a great burden on individuals and on the healthcare system. So this is just kind of an algorithm. And again, Andrea gave a great example of how it's often diagnosed. So depending on how you present, whether it's with symptoms or whether it's just for your annual PAP or semi every couple of years, depending on where you are on the algorithm. It usually starts with some sort of exam with either your primary care provider or with your gynecologist. That usually leads to a PAP or HPV testing. And then if that's abnormal, patients will often undergo what's called a colposcopy or just a biopsy of an abnormal finding on the cervix. And then depending on what's found, again, if we see a large cancer or if there are certain findings that are concerning, we may go straight to imaging, like a PET scan or an MRI to see has the cancer spread elsewhere, or will someone get an excisional procedure like a cold knife cone or like a LEEP procedure to get, again, a little bit more of a sense of the extent of the diagnosis. So from there, one of the things that we're determining is what stage is the cancer. So we talk a lot about stage when we're talking about cancers. In general, with cervical cancer, stage 1 means it's confined to just the cervix. Stage 2 means it's moved outside of the cervix into the tissues around it or into the vagina. Stage 3, it's moved even beyond that, kind of to, outside of the vagina and the cervix, kind of into the pelvis or into the lymph nodes. And then stage 4 means that it's moved somewhere else. In this, very generally speaking, patients with stage 1 cancer, we can often, but not always, treat with a hysterectomy, a radical hysterectomy. Patients with stage 2 or stage 3 end up getting chemoradiation. and stage 4 is chemotherapy. Now, there's a lot of variations within that. I don't know Andrea's whole story, but sometimes depending on where you are right here, sometimes you get chemoradiation as well. So it sounds like that might be your story. Yeah, that's really, really common. Most patients are not diagnosed at stage 1. Okay, it's about 50% are diagnosed, maybe a little less than 50% diagnosed kind of at stage 1, but more than 50% are diagnosed to the point where they actually have to have chemotherapy, radiation, and some combination of those for treatment. So this is just a little algorithm kind of what I was describing. I won't get into the weeds about all of this stuff. That's for me to know. But I think what's really important to understand is that these treatments have an incredible impact on patients' lives. And while they can be very effective, even if effective, the long-term side effects of cervical cancer treatment are really important to acknowledge, because again, these are often young women who have decades and decades of life ahead of them. So, like I said earlier, a lot of my patients with cervical cancer are mothers. A lot of them are in their 30s and want to be mothers, but might not be able to ever have children because now they need treatment for their cervical cancer that's going to require a hysterectomy or that's going to require radiation that will make it so that they can't get pregnant. A lot of my patients go into menopause early, which for anyone who's gone through menopause is miserable, and also has long-term, like health effects such as osteoporosis, heart disease, possibly even dementia. Radiation therapy, while incredible and incredibly effective and often curative for some of these cervical cancers, especially early stage 1, stage 2, some stage 3s, we call radiation therapy jokingly the gift that keeps on giving. So it works incredibly well, but in order for it to work, it also causes damage to tissues around where the cancer is. So the long-term side effects of radiation can carry on for months, years, decades. And this can be anything from just kind of mild changes to the vagina, to severe pain, significant problems with the bladder, with the bowel, and sexual dysfunction. And I think it's really important to recognize the quality of life that this can impact, and how important it is to recognize, just like Andrea mentioned, that finishing treatment is incredible, ringing the bell is incredible, but that's just the beginning of kind of the journey of being a survivor of cancer. And then I think it's also really important to recognize that cancer treatment is expensive. So the financial toxicity that cancer patients suffer is incredible. One example, radiation therapy, when you get it for cervical cancer, you have to get it every single day, Monday through Friday for 5 weeks in a row. And so you have to go to and from the doctor every single day. So if you have kids that you have to take to and from school, if you have a job that you have to go to, that is going to be interrupted every single day, 25 treatments for over a month. It's incredibly taxing on patients and again, these are women who are productive members of society, who are working sometimes 2 jobs, who have multiple children, who have multiple responsibilities. So it's an incredible burden to ask of patients. And then I think the kind of last point that I want to hammer home, while cervical cancer can be curable when it's in these early stages, even when we look at overall, again, we talked about the survival rates a little bit. When you compare it to the other cancers, so breast being the most common cancer that only happens to women, well, primarily women, the 5-year survival is 91% for breast cancer. For uterine cancer, the most common cancer I treat, it's 81%. For cervical cancer, for all patients diagnosed, at 5 years, only 67% of people are still alive. And again, for Black women, that's 57 or 58%, it's 10% less. And then in patients who are diagnosed at stage 4, so with advanced cervical cancer, the survival rates are dismal. Advanced metastatic cervical cancer is probably the worst thing that I treat. It is devastating to take care of a young woman dying of cervical cancer, knowing that it's preventable. That's why I'm here, is because it's such a challenging disease to treat. Again, this is just another graph that kind of hammers home the impact of how young patients are when they're diagnosed. So when you look at the average years of life lost to specific cancers. This takes into account the sort of deadliness of a cancer as well as how the age at which patients are usually diagnosed. And so obviously childhood cancers, the number of years of life lost on average is going to be the highest, but it's followed closely, or followed by testicular cancer, which tends to happen to young men. And then the next one is cervical cancer when you talk about the years of life lost to people who have cervical cancer. Dr. Gedkin, I don't want to steal any of your thunder, but I think, again, like I said, the hardest thing to see is especially women who are my age who could have gotten the HPV vaccine who didn't for whatever reason, dying or suffering of this incredibly preventable cancer. So thank you all for being here, and I would love for you to get rid of this cancer so I don't have to take care of it anymore. I love my job, but I wish I didn't have to do it. So.
Thank you, Dr. Jolley. And I think that's, I'll echo that sentiment. One thing that I often say is I want to work myself out of a job. I want to make sure that people get all their vaccines so that we don't see these diseases anymore. And I think that's such an important message, and especially for any of our pediatric colleagues that might be in the room or on Zoom right now. Something that I've heard from a lot of our other oncology doctors is, don't let your patients become their patients. If there's the opportunity to vaccinate, we need to take that opportunity. So thank you for just such wonderful and clear presentation of a lot of data, very quickly. So next I would like to introduce our keynote speaker, who's also another colleague at Emory University, Dr. Jennifer Getkin. Dr. Getkin is an associate professor of gynecology and obstetrics at Emory University School of Medicine, and is also chief of gynecology at the Atlanta VA Medical Center. So Dr. Getkin, we're so happy to have you here today to speak with us a little bit more.
A little bit more. There's been a lot that have been said. Like, generally speaking, there's very little left to say, but that's actually not true. But I will start by apologizing about my voice. I am suffering from or getting through one of the many viruses, not HPV, but many viruses that we are running around these days. And I want to, but I didn't want to miss the opportunity to be here at this exciting event. And I think it was the first time in the last 8 years where our lovely Triana Arnold, so I know her, Miss Arnold, James had invited me to come. And I finally could make it. So I was so pleased to be able to do so. So you guys have all taken care of a lot of my slides, so I'll probably be able to whip through a number of them pretty quickly. But I think the gist is, and what I'm trying to share is what we're all saying, which is that we hope that cervical cancer becomes a thing of the past and no longer, and not a part of our future. And as Dr. Dilley pointed out with the graph that she used as well, cervical cancer has dropped off our top 10, right? But if we were looking at the same graph 50 years ago, it would be right about here, number 2, which is actually where my colleagues that I work with in Ethiopia, and going to be heading over there next week, actually, still see cervical cancer at that rate. So as somebody who graduated in OBGYN, I see patients certainly with precancerous cervical disease, but I rarely see patients with cervical cancer. Most of those patients end up with I'm going the wrong direction with Dr. Dilley, but we just don't see it that often. And I bet if you were to ask people in your neighborhood, your friends, your family, how many people they know that actually had cervical cancer, maybe had abnormal pap, had to do some evaluation, but cervical cancer, it's just not that common here. But one of the first times I went over to Ethiopia to work on something completely different, my colleagues there kind of grabbed me and said, you've got to try to help us do something about cervical cancer. And so we started doing a little bit of this special kind of training. And it was amazing to me that the nurses that were helping us put on the training to do some assessment of people for and screening of cervical cancer stopped us at the end of the day and basically cornered us and made us do screening on them, because all of them had seen patients. Everybody knows somebody that's had cervical cancer, and there's almost nothing to offer them in places where there's almost no radiation to be had. So it is still a really big problem, and still surprisingly something we deal with here today. So now, who do we have to credit for the fact that we no longer see these rates, most people think of somebody named George Papanikolaou, right? But interestingly, and bear with me, I love history, his wife Mary, who emigrated here from Greece with him, was actually his sidekick, right? Was with him in the pathology lab all the time. But interestingly enough, and what people might not know, and I certainly didn't, was that she actually did self-swabs on herself. And over 20 years of self-swabs, that's actually what he was looking at. He was trying to see whether there was changes in the vaginal fluid having to do with menstruation and age and all this kind of stuff. And what they ended up finding by way of a party, all sorts of good things happen at parties, right? She convinced a few of her friends to do the same thing, collect a little vaginal. So I don't know how that went down. I don't know anything about those details, but it's true. And so they collected it, and sadly, a year or two later, one of her friends got cervical cancer and died. And they went back and looked at that specimen, and then were able to see the telltale signs of cervical cancer. And there began cervical cytology, or what we know as pap smears. And everybody used to get them every year. But to Dr. Dilly's point, we don't have to get them every year anymore. But anyway, and so as you see here, from the 1970s down to the early 2000s, our rate of cervical cancers dropped precipitously, right? White women having not as much a burden. That's something I'm going to be echoing as well too, but still high rates of like 12 or more per 100,000, down to where we sort of land somewhere around 6 or so thousand out of 100,000, right? And Black women up around 22 per 100,000, down to, again, this nice low number, but still not zero, right? So I would argue low is great, but even one person who dies from cervical cancer is too many. And so this one person that has brought us all here together happens to be Miss James's best buddy in the Army, right? Or in the military? Oh, it did, didn't she? Okay, I thought it was. Who sadly contracted HPV. And unlike most of us, as Dr. Dilly said, most of us will clear it, right? Most of us won't even have to worry about it. We might not even know we get it if we don't get a pap smear at the right time to catch it. She wasn't that lucky. She got one of the bad viruses that didn't go away, and she bravely suffered, but ended up succumbing to her cervical cancer in 2015. And hence we're all here today. So why don't we reach everybody with our screening? It's okay. We have good screening. We have this pap smear. It's terrific. And most of us get it. Most of us know all about it, right? But as what's already been said is that mostly it's people who are never getting pap smear. People not like Andrea, actually, people who have never gotten a pap smear, who rarely do. And I think again, just to say it again, but you can always hear it more than once, right? The barriers to getting pap smears or getting screening of any kind are the same barriers to healthcare in general, right? So socioeconomic is a big part. Geographic inaccessibility, right? So we know, and even in those maps that Dr. Dilly shared with us, it's probably more in the rural areas where people aren't coming in for the screening. They don't get screened for anything. They're not having as much access. And then I would say, and what I experience at the VA in particular, is oftentimes it's these cultural, personal preferences. So I take care of a lot of women that have suffered either military sexual trauma or sexual trauma in their past. And so the idea of coming in to have a speculum exam, as much as it might seem like a nothing to me, is really triggering, right? And so I see people all the time that got told they had abnormal pap smear, told they needed to come back to have some sort of a follow-up procedure by way of a colposcopy, lost 5 years, 6 years, right? And then we're behind the 8 ball and perhaps dealing with the same thing that poor Andrea did. So sadly, that's the reality, right? So I'm going to mention one of the last her cervical cancer heroes, Harold Zerhausen, was a German, died just recently. And he was the one that actually discovered HPV that we've talked about so much here, and its contribution to cervical cancer, and got the Nobel Prize in 2008. And interesting, he was actually what I would say is a vaccine visionary as well, because in 1990, this was his quote: "The goal to eradicate sexually transmitted carcinogenic viruses can be jointly carried by women and men and could be accomplished within a few decades." 1990. So we're a little slower than I like to think, but we're getting there, right? Because what we found since then is that, exactly like Dr. Dilly and everybody has said, is that cervical cancer is basically caused by HPV almost all the time. There's very few cervical cancers that aren't HPV related. And 16 and 18 are the really bad players. And it's persistent infection that causes cancer. And fortunately for all of us, it doesn't happen overnight. So it takes at least 10 years or more to get exposed to the HPV, then have it go to pre-cancer, which is this idea that Dr. Dilly has set out there for all of us. And even those usually would go away on their own, but the really severe ones progress, and then we end up with the cervical cancer, right? So these are this is sort of the timeline that we see with HPV and how it's been incorporated and how helpful it's been, right? In 2000 and 2003, we started seeing people doing HPV testing at the same time as your PAP. And I'm sure anybody in the room that's gotten a PAP here in the last 5 years has gotten a HPV testing at the same time your PAP. And what it's done is it's allowed us to space out our PAPs, because what we've learned in the meantime is that while PAP smears are great, they weren't super sensitive, meaning they didn't pick up cervical cancer, or really what we're trying to look for is pre-cancer, right? They didn't pick it up all the time. They picked it up just a little bit more than 50% of the time. That's why we had to come back year after year to get another PAP in case we missed it the last time. On the other hand, HPV, very different. It picks up 90% of people that are going to potentially go on and have pre-cancer. And so if you have a patient right here, the red line here, that's HPV negative, right? You'd have to wait 5 years before she might show some advanced precancerous cells popping up. 5 years. So it's not only very sensitive, it's very predictive. So that's why we've gotten to this point of being able to space out our PAP smears. So if you have a PAP that's negative and HPV testing that's negative, we feel very comfortable as your providers that you don't have to come back for 5 years. I can't tell you how hard it is for me to convince patients of that sometimes, who are like absolutely set. Are you sure? I really, I'm like, I thought you didn't like that speculum exam, So, okay. So, and now we're actually at the point 7 years ago or so where the US, I can never get all these, USPSTF basically suggested, right? Our big guidelines here that we should maybe just do HPV alone. We maybe can do away with cytology. Now, is that going to change very much for the individual patient? Not currently, because currently the way we do HPV is still, you have to come into the clinic, you have to have a speculum exam, we have to swab you, and then we send it off, right? So all it would do is save some money, not so much cytopathology being done. The pathologist can focus on other things, but it really wouldn't change the paradigm for the patient, right? But as of this past May, and maybe some of you have heard of this might be the only thing that I've said that's nobody else has touched on yet, is that the FDA approved the first self-test collection kit for HPV. So think about that, right? Has anybody had experience with this? Anybody done a self-test? You did? Awesome. Where did you do it?
Not in the US.
Oh, not.
Very fun.
Okay. That I believe. I was going to be shocked. That I believe. That's wonderful. So imagine this. You have a self-test where these patients who either by virtue of living far away, having physical disabilities such that getting into the hospital, getting into stirrups is difficult. Now instead, they can sign up to get the swab. They'll send it in the mail. They'll get instructions on how to swab themselves, pop it back in the mail to somewhere, or drop it off at a clinical or health center. And then they'll get a notification. It was fine, see you in 5 years, or we'll be back in touch in 5 years, or have some concerns, come on in, and then eventually they're going to have to be seen and go through everything else. But what a potential game changer, right? And this is something that Dr. Flowers is over there just kind of shaking her head in the corner there. This is something that there's a big push called the Last Mile Initiative by the National Cancer Institute. And it's sort of a federal and private and public collaboration. And they have a study that's already started.
Yeah, it started at Grady. I'm the PI first.
Yes, that's right. She is called the Self-Collection for HPV Testing to Improve Cervical Cancer Prevention, the SHIP trial. And so this trial is taking place, as Dr. Flower said, at our own Grady Hospital in Atlanta and many other places across the country. And they're going to study best practices to rolling this out and how this really changes our rates of cervical cancer and cervical cancer detection. And so this is going to be a game changer, right? A real game changer. But just because we pick up more cervical precancer, as Dr. Dilly said, you still have a lot that goes into that, right? So it's great that we might pick up more precancer and that we can avoid having patients have to come in so we can get rid of some of those barriers where people don't do it. But then you're still stuck with all this next steps, right? People having to come in and have colposcopies, multiple visits, anxiety, all the things Dr. Dilly spoke about. And to me, those are all opportunities for people to fall through the cracks, right? That's where they fall through the cracks, which is exactly why vaccine is what we need to focus most of our attention on. We won't get rid of this, right? Because there's still plenty of people my age and even a little younger that have not gotten vaccinated. So this doing self swabs, having colposcopies isn't going away in the next couple decades for sure, maybe even 50 years. Even if we were going to start vaccinating everybody tomorrow 100%. But that's what we need to focus on, right? So we need to pitch for and push for the CDC guidelines that say that every child, male or female, get vaccinated at 11, 12 years old. Can get vaccinated as early as 9, but by 11, 12, they should be vaccinated. And it makes a big difference. Up to 26, if you haven't been vaccinated, do it. After that, talk to your doctor and decide whether it's the right thing for you. And for many people, it would be, right? Do we do it? We know we have low levels, right? This has already been mentioned. We are not there yet. We are not getting there yet. Part of it is probably because it's not actually mandated like some of the other ones, right? And that's something I'd love to see a bill trying to push for actual mandating this. More girls than boys get done, but that's probably because this is thought of as being a vaccine for girls. Cervical cancer by default means it's like, oh, it's all about girls. We think about girls, right? Is it for the rest of the world that, you know, your average person doesn't think about herd immunity and these things that doctors think about and how we want to get everybody vaccinated to stop it altogether, right? And then there's a lot of other barriers, right? And Dr. Badarczyk has studied this and looked at this quite a lot of them being parental concerns. My kid doesn't need it. I never had anybody talk to me about it. My child's not sexually active. Let me share a little story. So shortly after the vaccine came out, and I won't say what hospital I was at or what colleagues I was with, but I was basically cornered in the cafeteria by 3 male colleagues, I'll say that, male colleagues in another specialty, but doctors who know a lot about vaccines, presumably. And they basically started asking me about this vaccine, like, is it safe? Do we really think we should do it? Should we get our daughters to get this? And of course, the resounding comment was like, my daughter's not having sex. And I thought, you're right. I'm sure she's not. But it doesn't matter, right? Remember, this is a vaccine. We want people to get it before they're exposed, Well, fast forward, and this is actually jumping ahead now that I think about it. Fast forward, a couple years later, one of the leaders in their department actually died of oropharyngeal cancer, which, as I'll share, and Dr. Badarczyk already sort of gave a nod to, is one of the other cancers that's related to HPV. And they changed their tune fast. So I do think some of this is because it's a woman's disease or is thought of as just being woman related necessarily. Other problems with not getting vaccines is that physicians, though most of them are talking to their teenagers about it, again, they're not catching the younger kids. They're not focused on where we want them to be. So even physicians are people that we can kind of push and give a nod to. So again, oropharyngeal cancer, 70% of it, not all of it, but 70% of it is caused by HPV and happens to be, I stole this slide from Dr. Dilly, thank you, because it put everything nicely together, happens to be on the rise and is actually increased, the rates of this cancer is actually surpassing cervical cancer, which nicely is dropping down, perhaps in part because of vaccination, right? And there's other cancers too, vulvar, anal cancer, but I think this in particular is probably going to get some people's attention, right? Because now it spreads across both genders. And so hopefully that will be enough fuel to fire it, as well as, Jana, can you help me? We're at it doesn't like to do more than a few slides. There we go. Oh, there. Even more fuel on top of, and again, stole my thunder here. The study that basically that Dr. Badarczyk was referring to, which basically says that not only is this one of the safest, well-tolerated vaccine of all time, it might be one of the most effective, right? I mean, it's amazing. I'd love to see this replicated many, many times, but it's phenomenal. But what's really important here is that these kids need to get vaccinated at the right time. So see here, if somebody was unvaccinated, the rate was high, 8.4 out of 100,000. Vaccinated older than 14, cut it down by more than half, but it was nothing in those that vaccinated at the right time. So really impressive data. And so I do believe that there will be, hopefully in our lifetime, a chance to eliminate this disease. And and actually show some respect to those that came before us, that Mary with her selfless dedication to this, Harold with his vision for his eradication of HPV, and Susan Jolley with her bravery in fighting this awful disease. I think they deserve it, and we need to strive to reach that goal. Thank you.
Very much, Dr. Getkin. I think having doctors like yourself and Dr. Dilly and all of our other medical colleagues here really helps us to again keep that clinical perspective and think about the implications. And like you said, where we've been and where we can go. And I think that's so important. One thing that I'll mention really quickly, and this has come up, different people. Andre had mentioned this about being of certain ages, not being able to get the vaccine. It was in the fall of 2019 when the Advisory Committee on Immunization Practices had that 27 to 45-year-old recommendation come in, that shared clinical decision-making recommendation. I was born in 1975. I was 44 years old when that recommendation got extended. I had 1 year to get that vaccine. You know what I did? Called my doctor. I went and I got that whole complete series. So again, it can happen. People can go, you can get these vaccines. It's out there, it's covered by insurance. And it's so important. I mean, all the data just continues to show us that. So next I would like to invite up Triana Arnold-James to give us some remarks. Again, Triana is the founder and president of the Susan Jolley Foundation. I've been lucky enough to see her here multiple years, to speak at these events through the years. I've always been moved by your words, moved by your story, and I would love to just invite you up to share that story again and share your words with us.
Thank you, thank you, thank you. Good afternoon again, all of you. I got my little sticky notes here so I don't forget anything. But I want to tell y'all a little bit about Susan. Susan, a God-fearing woman and single parent of two, a hairstylist. She was the reason why I was a natural blonde. Oh, and just a great person, all around. And she would, the only difference between Susan and I, other than being, she was a single parent, was that I was in the military and I had access to healthcare, as opposed to she did not. And like many Georgians, they use the emergency room as their primary care. And as a result of that, and over time, she was misdiagnosed. But I wanted to share a little bit about her because, like Andrea, putting a face, a human, a person behind what we're talking about, cervical cancer and HPV. And Susan started getting sick about 2013, and just symptoms, regular, her period, a little bit longer, things like that. And then around 2014, it got worse. And she was getting worse. And what happened, like I said, she was going to the emergency room, different emergency rooms, and they were diagnosing her with everything else. And my best friend, we used to talk every day. And she would tell me that she loved me 15 times before I got off the phone. And that was the kind of person she was. She went above and beyond. And she often, as we do as women, we put everybody on the front burner. We put everything in front, and then turn around and put ourselves on the back burner, and even including our health and doctor's appointments. And eventually we'll say, I'll get to it, I get to it, I get to it. And we never do. And so over time, in getting those many abnormal pap smears and not going back and following up, it turned into cervical cancer. But at the time, we didn't know. We didn't know what was going on. I mean, she was diagnosed with gallstones, kidney stones. It was her back. She was premenopausal, everything. Um, and no one ever said cervical cancer until one day we were up at Keystone Hospital. Anybody here work for Keystone? Good, because I almost got arrested, and I tell this story every year at Keystone. So make sure you ain't looking out for me. But I say this every year, and everybody knows. And if you could go to YouTube and you can see the Susan Q story, type in the Susan Q story. I go a little bit more in details about her and how it happened. And so we were at Keystone, and here it is. I saw my best friend in a fetal position on the floor of Keystone emergency room, and nobody would tell her what was going on. And my heart just broke. And yes, I got loud and I told them, no, I'm not leaving this hospital until somebody tell her what's going on. Till somebody give her an actual, you're not gonna give her a band-aid and kick her out the door. And it just so happened to be an oncologist there. And he said that to come over to his office, and he gave her all of the tests and everything that he could possibly do to figure out what was going on with her and listen. And the most important thing he did for her and for me was he listened. And so um, during that time, I had symptoms of my own. And this is where Dr. Getkin comes in, because y'all, she is my OBGYN at the VA. So, and I love her so much. We've known each other. Well, she's seen a lot of me. And I'm one of those ones that she said, no, you don't have to come back next year. And I'd be like, you sure? And would just try to convince me over and over that I did not have to come back the next year, that I can actually come back every 3 to 5 years. But I was not, and I'm still not convinced because, of course I want to see her, but at the same time, it's like, can I really skip next year? So I make it a point to send her a message on Messenger to say, let me ask you a question, just so I can keep in touch with her. So, and I know I probably get on her nerves, but we finally, and so at the time when Susan was going through her issues, I had issues of my own. But here again, I was able to go to the VA and get care, as opposed to her getting misdiagnosed and improper care through the different emergency rooms. And so finally, that was a Wednesday. We went to see the oncologist near Keystone Hospital, and then that Friday, he said he doesn't know for sure, but it looks like cervical cancer. And at that point, it was like stage 4. And then 5.5 months later, she passed away. Ironically, I guess during Cervical Cancer Awareness Month, she passed away January 8th. 2015, 10 years ago. And January the 11th, I started the Susan Jolley Awareness Program. January 15th, I buried my best friend. And then I went to see Dr. Getkin at the end of January. And she asked me what was going on and asked me how was my friend. And I said she passed, and I just broke. But over the years, just turning my pain into purpose and getting with Representative Evans and say, no woman should be dying because of cervical cancer. There's a lot of things that we could do. We could talk about the HPV. We can get the HPV test, but we got to get the HPV vaccine into the arms of young girls and young boys. And not just here in the state of Georgia, but all across, especially in the southern states, because this is where the numbers are high, especially among Black women and women of color. We got to get those numbers, and we can do this. You all are here as a testament that we can eliminate cervical cancer. And I start to say and I used to say we could do away with it, or cervical cancer is preventable. but I changed the language to eliminate because it can be eliminated. And then even in our work groups, those that are in the work group, we can do that where we pull ourselves together, pull resources together, come together, continue to advocate, get with our policymakers that were here today and stay the course. As Representative Schofield would say, keep it moving. We can eliminate cervical cancer. We're all doing the work, but we need to continue to do it together. So a couple of people I want to acknowledge, of course, like I said, between God, Susan, and Dr. Gecken saved my life. I want to acknowledge my family, my husband, my daughters are usually down here with me as well. And my husband, AJ. Yeah. Who's the muscle man, everything. Of course, like I said, the original, the OG Representative Evans and Representative Mitchell, who didn't stop by today, not Representative, Senator Rhett, who also helps us on the Senate side when it comes to HPV. And of course, Susan, because if it wasn't for her, and I know I'm a God-fearing woman and I know God doesn't make mistakes, and it was her time, it was her time. But as she was going through those symptoms, like I said, I was going through the same symptoms, but I was able to get care. But Susan is like a lot of, especially in rural areas, a lot of Georgians in rural areas are not getting the care. We don't have the OBGYN, we don't have the access. And so that's why I get with Representative Evans and Schofield and Davis and Cannon and Senator Rhett to say, okay, these are things that can help give access in rural areas. But they are always, and then Representative Pruitt as well. When I started this fight or advocacy, hospitals was closing down. As you all know, Georgia didn't expand Medicaid, but hospitals were closing down, especially in rural areas. And getting with him in his district is 80% people of color. And he's a white guy Republican. So, but he did not know what was, and I'm nonpartisan. I just wanted to bring that out because that tells where people are and how access, was not there. But he didn't know. So I went to his area and I went to him and I said, look, people are having to travel 50 miles to the nearest emergency room. There's no OBGYN, there's no access. And so for the next couple of years, we opened 2 urgent care centers in his district, and he allotted any federal funds that came to his district to go to people if they had a life and death situation, that they wouldn't have to pay that bill and they would be airlifted to the nearest hospital. And so thank you. So we're doing the work and we continue to do the work. He's retired now, so I have to go with, some other people in the area, but I have, great people that I can go to and say, this is what's happening. Because here's the thing about me, y'all. I might have my heels on today, but I'm boots on the ground. I will go into a clinic, I will go into, into the dungeons, I will go on the streets to talk about eliminating cervical cancer and how to get to HPV vaccine. But all of those legislators, I really appreciate them. But also, I want to acknowledge the ad hoc committee. The ad hoc committee, can y'all stand those that are here? I mean, Astrid, where is she? Ryan. I want to acknowledge them because they've been putting up with me for the last couple of months. And I know I'm really not, when I'm planning, I'm not the easiest sometimes. And I'll say, yeah, or I'll say, no, we're not doing that. But I just wanted to say that I appreciate you all so much. And Jana turned the reins over to me to chair this committee. I don't know if I'm gonna do it next year. So Ashley, I'll be here. But it's really just been a pleasure to work with you all and it's so many pieces to put in this day together. It's not just coming down here and having food and sitting around. It's a lot of pieces that we have to put together to put this day on. And if it wasn't for the committee, I would not been able to do it. You know, Bella, did you stand up, Bella? You did? Okay. And you, oh, back there, okay. Grace, especially Grace, you know, late at night talking to Grace on the phone, just walking through it, and Jana just walking me through everything that needs to be done. And I just really appreciate each and every one of you and those that are here and came out. And don't just take this day, take a picture, but take the information, take it back in your respective organizations and clinic and things like that. And then come back and say, hey, you know, we want more information, or we, you know, we want to have a table, or we want to give out more information. However you want to do it, let's do it, because we can do it and we can do it together. But thank you all so much. And I think on to the next thing. Um, Make sure you stop by the Susan Jolley and take some trinkets and bracelets and all of that stuff that's on there, because that's what we have that for. But I appreciate each and every one of you, and the Susan Jolley shirts. Can you stand up so everybody can see it? Y'all, this is actually, we're debuting today as an 501c3 organization. So 10 years of doing this. Thank you all so much. Thank you, Dr. Frost.
Thank you so much, Triana, for sharing that with us. And like I said, you know, this has been a labor of love that you've done for a number of years. We're happy to be partnering with this, to have you as a continued sponsor here. You know, as I said, I've heard you tell this story through the years, and it's just as moving as the first time that I heard it, and I really appreciate that. I would say professionally, I wish that we would have had the opportunity to meet under better circumstances, but I'm glad that I have the opportunity to work with you and to really keep bringing everybody together for this fight. So thank you so much. I will mention, as Triana said, about, you know, taking some of the materials home. You probably saw in your chairs floating around. There's the signage that's there. This is part of the, I mentioned the HPV Roundtable of the Southeast. We've been really working on trying to get HPV vaccine normalized in the context of what we normally think about in the South. And that's what those posters and flyers are there for folks in clinical settings. All of those are available if you go to the HPV Roundtable of the Southeast website. You can get those materials. So again, just trying to normalize it and make it something that we do in the South. So trying to pull that forward. Next, we do want to recognize and announce our HPV champions for 2025. We did have one group that did have to leave early, so the East Georgia Cancer Coalition. So we want to thank them again, as they were here before. But we do have 5 more champions that we do want to recognize today. So the first 2 that we want to recognize are our clinic champions. And these are 2 clinics that have been identified and selected by Georgia DPH immunization
Eso fue porque
coordinators
nosotros siempre
and
ponemos.
staff for the great work that you've done in improving and sustaining high HPV vaccine coverage rates. And because of that, we do want to recognize you. So the first one that we would like to recognize is the Turner Elementary School-based health clinic, a federally qualified health center that provides care to students in that school. And I went to graduate school in Albany, New York, so I'm going to say Albany, Georgia. I know that that's not proper. I know that's not correct, but it's what's ingrained in my head. So in Albany, Georgia, and here to accept this award, I believe, is Katie Moreau from the health center, or anybody from the health center. Okay, yeah, round of applause, and we'll make sure that the award gets to the Turner Elementary School-based health clinic. Our second clinic partner, or second clinic champion that we want to recognize, is Georgia Highlands Medical Services, the Highlands Medical Plaza Pediatrics in Cumming, Georgia. Again, identified through our partners with Georgia DPH based on their immunization coverage rates. And I believe here to accept on behalf of Georgia Highlands is Mauricio Ayala, or any other staff from Georgia Highlands? Okay. All right. Again, we'll make sure that award gets to you. And next, we do have 4 community champions. Again, as I mentioned, the East Georgia Cancer Coalition was one of those out of Athens. We would also like to recognize our partners, and hopefully y'all are here today. The first one we'd like to recognize is Atrium Floyd Family Practice Residency Clinic in Rome, Georgia. I believe that we've identified Doctors Pam Obi and Lisa Black. Are there any representatives from Atrium? Okay. So, just a quick note, Atrium Floyd Family Practice, they have had an annual initiative for men's and women's health over the last 7 years, where through their women's health clinic, they've provided pap tests and clinical breast exams to over 500 women, including follow-up no-cost care for any abnormal test results. So thank you to them. Our next community champion is Healthy Savannah from Savannah, Georgia. Okay. So the names that I have, and I'm not sure if this is you all, Dr. Elsie Smalls, Patricia Mary, Paula Chrysler, and Armand Turner. So Richard. Oh, okay. So Healthy Savannah trains community health advocates using the Think Equity Toolkit to establish new and innovative community engagement strategies. They've done a lot of HPV awareness work, facilitating partner meetings, getting collaborations going in that part of East Georgia, linking those HPV partners, the community health advocates, and the broader community to help support HPV vaccine uptake. So we'd like to acknowledge Healthy Savannah. All right. All right. Oh.
Actually make 2 to 3 minutes of comments
Yes.
since nobody else did. I'm just going to everybody else.
No, I'm teasing, but they did send a couple notes up. I'm Amy Haywood Hughes. I'm a lobbyist here at the Capitol. I've been here since, well, years now. So I want to thank you for what you're doing here. It's so important. There's so much bias. There's so much anti-vax bias going down in this building right now. It's just not even funny, right? So what you're doing matters. And to hear that we can eliminate this disease is amazing. But I do want to tell you a little bit about what the Healthy Savannah folks are doing, if you don't mind. And I'm accepting this on their behalf. They were so thrilled about a year ago, I guess it was, to receive this grant from the GC3 and the HPV Cancer-Free Georgia Workgroup through the Creating Healthier Communities. That's where they got the money from. And they have put it to good use over the last year. They have trained 32 community members as HPV community health advocates. And what they've done is they've worked to increase awareness, education, build trust, build demand, and also build uptake for the HPV vaccine. They've nurtured a network of clinical and community partners to increase access to the vaccine in Savannah. And they've held listening sessions and roundtable events with over 20 community organizations that serve youth, public education, colleges and universities, and the faith community. But what they found in all of that is there is so much work to do because there is so much I won't say ignorance. There's so much opportunity to help people understand. They're just not aware of HPV related diseases and cancers. And they're not aware about the recommendations about the vaccine and the availability of the vaccine. So the vision for Healthy Savannah and for this initiative is Savannah is a community free of cancers caused by HPV. There's still a lot of work to do, but thank you for your support and for the recognition for this. Now, the first note I just want to say, since we have all these wonderful Emory folks here, I have a family member. He's my cousin, 67-year-old male, who just finished up a excruciating round of let's see, what was it, like 7 weeks of Monday through Friday radiation and 7 weeks of chemo in December. He just wrapped up his treatment at Winship for throat cancer, and it's specifically tongue cancer. And, you'd think that if he had had the opportunities for a vaccine earlier in life to avoid that, and that's what these folks up here are missing. They're missing that connection. So here's your opportunity today to help them get it. It's about our daughters and our sons, but it's also, it's how do you create quality of life
for your children forever.
Right.
Right. So anyway, thank you for what you do.
And our final community champion that we want to recognize is the Georgia Campaign for Adolescent Power and Potential, or GCAP. And do we have GCAP representatives here today? Okay. So hopefully Michael Armstrong, that's the name that I have. Okay. So wonderful. So we have Michael Armstrong here to accept this. GCAP has work to really train, engage members of a youth advisory council, to advocate for HPV prevention, within their communities, within their peers, within all of their peer networks. They've developed legislative toolkits to help support a lot of this work to address the impact of HPV. They've been, very active partners in a lot of our initiatives. We've seen them interact together. They're integrating HPV prevention education into a lot of their new initiatives, working, with new school systems and youth. So again, thank you very much to GCAP for all of the work that you've done. And
thank you to all of you for this recognition on behalf of the staff and the board. We're grateful. Something I know that we all have in common in this room is that we want to be healthy. Tell me if I'm wrong, but and that is also true for young people across Georgia. They just need the information and access to resources to make the right decisions to be healthy. And that is the business that GCAP is doing every day. We are educating and empowering and creating access to opportunities for young people who normally don't get that. And that is what we apply to our efforts to eliminate HPV and promote vaccinations. And I'm just grateful that this work is being recognized. So thank you, everybody. Oh, gift cards.
all right, so our next item of business, we are coming close to wrapping up. We have a few more things that we want to talk about, and these next two things are going to be calls to action. So again, you've heard a lot of information today. You've seen a lot of good stuff, but now where can we go with this? How can we move this forward? So what I would like to do now is I would like to invite Triana back up. Oh, yes. Okay. Okay. So now we'd like to invite Dr. Erica Paez, one of our colleagues who's on HPV Cancer-Free Georgia, to give us a call to action about best practices to improve HPV vaccine as we work towards this goal of elimination.
Good afternoon. Thank you for the invitation. This is an honor for me. I have been working with an amazing group, good support for education and prevention in Georgia. Particularly my side is the pediatric side. I work at Imagine Pediatrics, an independent clinic here in Rome, Georgia. And I have been working with multiple organizations with education prevention, including MAs, PAs, nurse practitioners, physician assistants, in other words, and medical students, residents, particularly educating the new generations, the community. And I'm going to give you some pieces of information, including what is important in pediatrics and especially for the younger generation. So basically, we need to let the new generation know that HPV is real and not just the infection, but also the vaccine, that you can use the vaccine to prevent the advancement of the disease and the fatal outcomes that nobody wants to see, especially it could be your family member, it could be a community, person that you know, your friend, anybody can have this situation, including myself. So the idea is to get a educated community, and with the kids having the option to get the vaccines in the office. We usually recommend to start with this information around 9 years of age. You can start with the conversations, recommendations, and some of the families, they're more open to get the vaccines now. And if they're not ready to get the vaccination, you can do it at least when they are 10. And many families, including the parents, they're open to have that in addition to the vaccines that they get when they are 11 years old. And so, as you know, this is a preventable disease, and the sooner, the better. So we have the recommendation if the patient, the adolescent, the kid is between 9 to 14 years old, they can start with the schedule at that age and they will get 2 dosages. You can give the one, let's say today, and then in 6 to 12 months, you can get the second and last dose. And for adolescents more than 15 years of age, they can get the vaccines, let's say again today, and then the second one in 2 months and the last one in 6 months. And remember that the newest recommendation is to extend that coverage up to 41 years of age. Next, please. So, and remember that all of this is evidence-based and it's recommended for the main organizations like the CDC, the American Immunization Organizations, and the American Academy of Pediatrics. So we have a strong evidence, not just with the practice experience, but also research proves that the sooner, the better. And also, if you start with the conversations, people is going to be more willing to get the vaccine because at 9 and 10 years, you can start with 1 or 2 vaccines instead of waiting later on when you get more vaccines and more chances to get the refusal of the administration of this vaccine. Next. So remember that we have a long-term effect, the data, the research. The motivational interview is the key also with the families and the adolescents, because if you have empowerment in the communities, they're going to be disseminating the information and more people is going to come to the clinics or they will go to the health departments to get the vaccines. Make sure that you have a good quality and educational program, not just with the team members in your clinic, but also in your communities. And remember that patients and families, they're looking for the confidence from the physician, your recommendations in general from the medical team, and get the written and verbal consents. And remember that in any occasion when the families are saying, no, we don't want the vaccine, remember education, keep giving the conversation, keep giving the tips, the advice to the families, and also documentation is important because the more that you do, the more information they will have and the more, yes, I want to get the vaccine today, you will get in the future. Next. So, and remember also that working with the families, you get the acknowledgement of what you're doing as a community member, but also as a physician, in my case, a pediatrician, and the recommendations, they will have what is there out there, like the evidence, strong recommendations. You can start by asking them when they refuse to get the vaccines, what are the concerns? Because many times it's just the anti-vaxxers, the misinformation, myths, and including the social media, which is good in some occasions, but it is also a good place to get confusion for the families and the patients. But remember that our goal is to prevent bad outcomes, so prevention and education is the main goal. Next. And know your patients, know your communities, and get informed. Keep the information in your clinics, like multilingual information, different languages. Remember to address the questions, concerns from the families. Also direct them to the CDC website. You can find any information in any language about any vaccines, specifically HPV, but also keep the extra information for your team in your clinics, for your patients, and they can read about that. They can ask the questions. You can educate them with real information every day that they come to the clinic. Next. So I think that I just wanted to make sure that you get this information for the patients, for the pediatric patients, because they are willing to hear what you have to say. Thank you so much for this invitation, and that's all for my side.
Did you say hear me? No, well, thank you anyway. Okay, so, I'm gonna make this real quick because the photographer for the official photo is out there waiting on us. The other call to action is, HR 3633. And you can read more about it on congress.gov and type in HR 3633. And that is the HPV Cancer Prevention Act that they're doing on the federal level. Representative Kathy Castor, I've been working with her office, as well as the Health Committee in Washington, D.C. And then I found out there's another committee that have come on board. And I think it's the Energy and Commerce, which I don't really understand, but I get it anyway. That's gonna be helping to push the bill. The bill is nonpartisan. So here we have, like we said, the House and the Senate. And we have our resolution bill that they issue us every year, and we have the information on the desk of the representative as well as the senators, so that they're armed with information on why we're here. Okay. And then Representative Schofield bill HB 174. And if you just go to Google or DuckDuck or whatever, Safari, whatever you use, and type in Georgia HB 174, and you can read up on that bill. And basically what that bill does is get, yes, thank you so much, is get the vaccine, the HPV vaccine, listed with the Department of Education, so that when they push out all of these vaccines, you know, that the children need, HPV right now is not listed. So that bill is going to get it listed. And then it's also going to help us to create, on a policy level, help us create an educational campaign with the with the Board of Education. So that's why it's really important. So if you don't know who your representative is, go to mvp.sos.ga.gov or my voter page and pull down your voter registration. Thank you, husband. Voter registration. And because I'm trying to get through it. And then you'll see who your representative is. Then I recommend that everybody call your representative and tell them to sign on to Representative Schofield's bill. And then on the federal side, what we do in Washington, D.C. is that bill that's the HR 3634. Now, these numbers are going to change, but the wording is not. So if you go to the legislator and put in this information, it'll come up. If you put in Prevent HPV Cancer Act under congress.gov, it'll come up. These numbers, like I said, is going to change. Okay. But we need everybody. We have 16 co-sponsors on that bill right now, which when we started all this, we had 1. So we got 16 now, so we're cooking with Crisco. But it takes all of us. I know, I'm so country. Everybody heard that saying, we're cooking with Crisco.
You know I am.
Okay. But we need all hands on deck when it comes to pushing these bills, because that's what's going to help us as clinicians and advocates and survivors to eliminate cervical cancer and eventually save lives. Because that's what we want to do. We want to save lives, right? Yeah. Right, everybody? Yes. Thank you so much. So with that being said, I don't think it's, so remember those 2 bills. That's our call to action. And then I'm also going to give you the PMI, the Pencil Me In initiative. Take 30 minutes out for yourself. Pencil yourself in. We're always penciling everybody else in. And we're always putting everything else before we put ourselves. Take a day, a half a day, 2 hours, and do absolutely whatever it is you want to do for yourself, because self-care is extremely important. And I just learned that lesson. So do that. That's so-called action. So PMI and these bills. You can leave your things in here, and we can shuffle out to take the picture, so we don't hold up. Not yet. Hold up the photographer, and then we can come back again. And you can get your things.
So just very quickly, thank you all for your attendance today. As a reminder, to claim CE credits, there's information on the table outside. A follow-up survey will be sent. If you're interested in anything that HPV Cancer-Free Georgia is doing, our state HPV working group, we have all of our social media accounts. There's information where you can contact DT Dola, who is our coordinator for this. that, please follow us on social media. Please get involved. If you'd like to join the working group, we would love to have you involved in this. You can email to DT. But again, thank you so much for your time, your attention today, for this very, very important topic. And let's go immortalize this.
And actually, you know, the other two champions, I'm gonna see them in a couple of weeks, in a week.
Okay.
So I can give them their
We're done.
flag.